Welcome back into Wave 3 Listens Live. I'm Michael Vanover, joined again by Dr. Mays with Mays Dermatology. And Dr. Mays, we talked about a lot in the first segment, but we've got even more to get to here. So one of the things we touched on was the sun getting ready to come out in a big way with summer around the corner. But one of the things that I think are important that people need to check is mole checks, self-mole checks and things like that. There used to be an acronym, right, about when to get checked or when not to, what to look for. Can you talk about that and how that's maybe changed now?
Yeah, so the acronym still stands, the ABCDEs, and it really guides patients into, if you were to perform a self-skin examination, what things to look for: asymmetry, border changes, color changes, things to kind of get worried about and come see your dermatologist. But since then, the new guidelines have come out, really recommend an annual skin exam by a board-certified dermatologist, because there's a lot of times those things occur. Something is growing or something is asymmetrical, but not really worrisome, and vice versa. So we didn't want to just put that all in the patient's hands to worry about. Really take that to your dermatologist. Have your annual skin exam, unless you have a history of skin cancer where you would do it more often.
Well, I think it's important. People at home, normally you're like, okay, I need to get this checked, but I don't want to wait 2 months. You can go the same day. So just call the number on your screen, go to the website, and go see Dr. Mays in St. Matthews. So again, self-checks, but really come and see you and get that second opinion. I mean, you're talking about some serious stuff here, and it's
yes.
nothing to take lightly.
Absolutely.
All right, so I teased this in the last segment, but I want to talk about this more. Hair loss. Fortunately, at this point, I still have a full head of hair, but I know a lot of people, I've got friends that do not. What are some things, I guess, for people like me that didn't realize that dermatologists are the place to go for that?
Yeah, so I actually am really passionate about educating patients about who the real medical specialist for hair loss is, and that is board-certified dermatologists. That's who gets most of the training in diseases of hair, skin, and nails, and that includes hair loss. There's over 120 different causes of hair loss, so seeing your board-certified dermatologist for a consultation to determine what the type of hair loss is, so they can really go over the treatment options, is key. So having that right assessment and diagnosis firsthand.
That's awesome, and you guys have had great success with that, I'm sure.
Yes,
I mean,
absolutely.
That's a huge deal for sure. Okay, let's talk a little bit more about cosmetic. People hear the word cosmetic, obviously they know it's trying to look better, feel all of those things. Go into a little bit more detail, if you don't mind, of some of the various things and some of the results that your patients have seen.
Sure, yeah. So cosmetic dermatology, again, very specified for board-certified dermatologists as part of their training. They're basically experts in the skin, so they treat skin conditions, but also that includes cosmetics. So that would be injectables like Botox and filler, but also facials, dermaplaning, lasers, vascular lesion removal, brown spot removal, melasma, any and all things, including medical grade skincare, and really giving you a consultation about what type of skincare you should be using, and or if you need compounded prescription for medications, for example, added to your regimen.
Okay, absolutely. Again, we have a special, by the way, that we have to talk about. We talked about it the last time. I want to talk about it again. Free dermaplaning, right? Talk about that a little bit more.
Yeah, so dermaplaning is a procedure. It's a pretty cool procedure, actually. You take a surgical blade and you go over the epidermis with the blade, and it really removes the fine peach fuzz kind of facial hair, gives the skin a renewed glow, but also kind of removes that a dull skin texture that patients complain about. Results last usually 6+ weeks. It's a really nice, safe, low-key, low downtime way to remove facial hair and just kind of get a nice glow.
And that's for the first 10 callers, so make sure you take advantage of that. Yeah. So, Dr. Mays, we've covered a ton of stuff here today. I can tell your passion. I can feel it on set here. How important is the education side of helping people in this community? I know, like you said, you came back home, you care about this town. I feel like this has got to be an area where sometimes the education is not always there. How important is that to you?
It's very important. I spend a lot of my consultation time educating patients on who they need to see for what, why the skincare recommendations from, for example, a grocery store or a beauty store is not the same as a board-certified dermatologist, why they need to come in for their hair loss diagnosis sooner rather than later so they can have the right diagnosis. So all of that goes into the consultation, usually for patients, as to why we do certain things and why it's recommended to see a dermatologist.
All right, so another thing, somebody's watching at home right now, they've been going to the same dermatologist for years. Why change? Talk about some of the advantages, and other than, of course, the same-day appointments, and why they should give Mays Dermatology a shot.
Yeah, so we really try to cater to patients' time and fit you in when you have a worrisome spot, or if you just need something checked immediately. So we kind of stand by that the same day if you need to get in pretty soon. We offer a full service of dermatologic services that's medical, cosmetic, and surgical, so that if you have a skin cancer, for example, you can have it taken care of in the office setting, all under local anesthesia, which saves patients time and money. And then we also try in kind of going to improve access and patient compliance with treatment. We try to offer, we have an in-house pharmacy offering generic medication access, so for patients that their insurance does not cover the medications they need to be on, we have a very kind of affordable pricing for them so they can get their treatment, whether it's a skin product or medication.
Well, that is a lot of reasons to consider Mays Dermatology. Plus, she's a mom of 3 kids. I don't know how you keep it all straight. I don't know how you do it all.
It's pretty crazy.
That's what you do. It's crazy, but you make it happen. All right, one more time on the screen. We're going to put that offer up there. The first 10 callers, free derma planning. It's a $100 value. Make sure you take advantage of it. MaysDerm.com, 502-384-6544 is the phone number. Dr. Mays, thanks so much for the education today.
Thank you for
Appreciate
having
you coming
me.
on. Absolutely.
Thank you so much.